light. Wide camera action. Hello. Hey yo. Oh shoot, I have to go in here to look at the chat. Here I am. Wow. Wow, wow, wow. Study till Babes gets here for dinner. Chef Babes gets here. I'm gonna try to put my little pediatric book online. So, I've got the chat here. Oh, because I can't make it smaller. Hi everyone. Is anyone else studying? This is a pretty cool setup I got here. So, what am I gonna do? Oh yeah. Hi bestie. Hello. That was a good session, right? With Doctor. Hi Jackie, watching TikToks while Thomas studies. Ooh. You know, I still don't have TikTok. Should I download it? Should I download TikTok? Hi. Hi Vic VTV. Shout out to you. Hello, hello. Hello. Let's see. So I'm studying liver right now, y'all. And I'm on liver tumors, so there's just too many tumors. Jackie, you could get swallowed in maybe after PEDS test. Yeah, you're right. That'll be my gift. If I do pass, then I'll get TikTok. Oh, hi Amy. Writing a speech. Ooh, what are you writing about? Hi Vic, I'm good. I just have all this stuff to go through. I'm on page 196 for chapter 10. And it ends on 208. So I guess that's not bad. Guess it's not bad. I'm gonna try to get this like pediatric sonography book. I'm gonna get the online thingy so I can put it on her. So let's see. An intro speech on what I believe. Ooh. I'm not good at writing speeches. Not good at all. Good luck. So you must be doing that right now. medicine.lww.com/activate. Ooh, I can't type. Activate. Congratulations, you're a few steps away from activating your digital access. Ooh. Ooh. my information. What best describes your role? Medical student, nursing student, resident, fellow, practitioner, nurse. What do I put? Resident, fellow. I'm none of these. Where do you practice? Send me communications. Role is required. Okay. Program coordinator. What am I? I don't know. Medical student, I guess let's just call it. Oh, what? Okay, let's just say I'm a medical student in the United States. This walking? Save. To begin, enter your email. Oh, I gotta make a password, y'all. It's so hard to study, but there is always a fruit of labor. You are correct. Studying is hard. Hi, Broed. Hi. I'm trying to create an account. I probably shouldn't show this because it's asking me for a password. So, un momento. Un momento. Must contain at least 8 characters, an uppercase letter, a lowercase letter, and a special character? Oh my G. That's too much, y'all. What is your favorite sport? What is your favorite flavor of ice cream? What is the name of your favorite pet? When you were young, what did you want to be when you grew up? What was the last name of your favorite teacher? They make this really hard. Stuff that you probably can't or won't remember. Okay, I'm just gonna choose this one. I agree. La la la. What are you guys doing today? Save password. Ooh, yay. Can I bookmark this? Okay, I'll just put Peds Ultrasound book. Hi, Broed. What'd you do today? I am studying the liver. Let's see, how do I find what page I'm on? Ooh. Oh, wow. Wow, this is pretty cool, y'all. I've never done a book which was online. That's cool. Interesting. Wow, look at all this stuff. How do I navigate this thing? Oh, okay, I'm in chest for some reason. Oh, here are stuff. Library, table of contents. Ah, got it, y'all. Let's study. I'm gonna study for a little bit. Yay. Thank you guys for showing up. I'm going to study. Jackie, sometimes I let the book read to me. Oh, I wish. Sometimes reading makes me so sleepy. Like, that's why I have to, like, take notes and stuff. Okay, can I move? Oh, I can move this like this. Watch, ready? So I'll move that here. Move this here. Go listen to some musica. How do I get to my playlists? You guys, how do I get to my playlist? Oh, me. And then, this is workout. We don't want to listen to workout music. We need to listen to study music. Okie dokie. So where am I? I'm on liver. Oh, this is so cool, you guys. Look at this. Table of contents. Wow. Okay. So I'm going to leave this chat here. We're going to start at 6 o'clock. And I'm going to just study real hard. As much as I can. Till Babes gets here. Liver. Ooh, so cool. Wish I had a dual screen monitor. I do not have such thing. Okay. Currently, I'm on hepatocellular carcinoma. So I went through liver tumors yesterday a little bit. Hepatoblastoma, the most common malignant liver tumor in childhood. We need to know that. Okay. Oof. Got my boba. Y'all got your drinks? We can do this. There we go. Guess you don't really need the computer. Right there. I'm going to talk about this stuff out loud because I need to. Hepatocellular carcinoma peaks at 4 to 5 years and again at 12 to 14 years. Half of the patients have a pre-existing condition. Such as glycogen storage disease, hepatitis or cirrhosis. And sometimes on ultrasound you're going to see solid masses of variable echogenicity. Oof. Oof. Let's see. I'm gonna ask some questions. Maybe y'all will know. Do y'all know what leukemia and lymphoma is? Because you'll need to know that for the liver. Leukemia and lymphoma. Things to quiz yourself on. What are the 3 things that describe cysts? There are 3 specific things that describe ultrasound cysts. Do y'all know that? Oh! Do y'all know that? There's 3 things. So I'm reading about hepatic cysts right now. Hepatic cysts, they could be congenital or acquired. Okay, so congenital hepatic cysts occur when an intrahepatic biliary duct fails to involute. Acquired hepatic cysts are usually due to trauma or infection. Cysts are usually solitary, have an epithelial lining, and contain serous fluid. So they typically don't need to be followed up or looked at. Do not require follow-up. Hepatic abscesses. Know the differences between cysts, abscesses, fluid collections. What else? Masses. Know what complex is, how to describe it, if it's rounded. What else? If it's irregular, if it has borders. All those different types of things. Abscesses usually look really irregular. Hepatic abscesses. Pyogenic abscess, amoebic abscess. Things that your medical terminology class will help you with. Hello, Kai. or Key. Thanks for coming. Pyogenic abscess. So pyo usually means pus. Pyo, pus. P-U-S. Localized collection of pus. Blech. Hi, Stephanie. We're studying the liver today. Pyogenic abscess. Localized collection of pus. Pyo, pus. Pyo, pus. Haha. Hepatic parenchyma. Sepsis, leukemia, drug therapy, appendicitis, cholangitis. More common in the right lobe of the liver and are commonly multiple in children. Commonly multiple in children. Hi, Active Aya. Thank you. See you next time. If you're not studying, study with you next time. Amoebic abscess. Amoebic. Amoebic abscess has to do with parasites. Parasites in the intestines, where it invades the liver via the portal vein. Ooh, so amoebic. You can definitely tell the difference between pyogenic and amoebic abscess with just the words, right? So let's hope I can remember that. Pyo is pus. Amoebic has to do with a parasite. Y'all, this is what I do. Ooh, infections. Yep. Pyogenic abscess. You know what it is. So pyogenic abscess, injuries. There's pyogenic, looks really irregular. Looks almost like heterogeneous. Yeah, and thick-walled. Versus the fungal abscesses. Fungal infections. Oh, here's the parasites. Ooh, parasite infection. Yeah, you can tell it looks way weirder. The parasite infection, the amoebic abscess, looks way weirder than the pyogenic abscess. Yep, weird. Weird, weird, weird. Parasite. Parasite. Right lobe of liver. More common. Endemic to the tropics and spread person to person. Tropics, person to person. Ooh, another one that I don't know how to pronounce. Amoebic abscess, yep. Granulomatous tuberculosis. Oh, Where's this one? Echinococcosis. You guys, medical words are so hard. Echinococcosis? Echinococcosis? Man. It's a parasitic tapeworm. Stephanie, I will study anatomy over this. You got this though. So echinococcosis, coccosis, looks like a honeycomb. Look at this. Looks like a honeycomb. Honeycomb. It's like a circle. Looks like all these little cysts. Parasitic. Ooh. Parasitic tapeworm. Echinococcosis. Sheep, cattle, and raising. Oh, sheep and cattle raising countries. Oh. In the sheep and cattle raising countries, you will see these parasitic tapeworms. Oh no! What is trypophobia? Jackie, what's that? Fear of trypo. I'm not sure. Not sure. Parasitic tapeworm. Sheep and cattle raising countries. Honeycomb. Eggs are swallowed by the host and they pass into the portal venous system. Cyst within a cyst within a cyst within a cyst. Cysts with daughter cysts. These cysts have daughters, y'all. Oh, fear of shapes in the same pattern. So do you not like kaleidoscopes? Is that a thing? Kaleidoscopes maybe? Do those bother you? Parasitic tapeworm is all blah, 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 blah. Oh, it's also known as a hydatid cyst. Am I saying these things right? Hydatid cyst. Hydatid cyst. Honeycomb. Water lily sign. Schistosomiasis. Bye, Vic V. Thanks for coming. Schistosomiasis. Schistosomiasis. Y'all don't judge me, okay? Schistosomiasis. Invasion of portal vein by schistosoma ova. Invasion of the portal vein by schistosoma. Well, that makes sense. That's why it's called schistosomiasis. It's invasion of the portal vein by the schistostoma ova. Leads to portal hypertension. Echogenic portal vein. Cirrhosis. You all know what cirrhosis is. Cirrhosis is very common. Cirrhosis. Do y'all know any reasons why somebody may have cirrhosis? Cirrhosis, cirrhosis, cirrhosis. You will see cirrhosis in ultrasound. I gave up trying to pronounce all those words nowadays. I just try to remember spelling those words. I promise you, Stephanie, I won't be able to spell schistosomatosis. Schistosomatosis. Yeah. I would definitely lose a spelling bee, for sure. For sure. Cirrhosis. Like, I bet you lots of people will forget to spell cirrhosis with that silent H. Cirrhosis. Cirrhosis. Children need forms of cirrhosis are biliary and postnecrotic. Biliary. Yeah, liver cirrhosis. Yeah, you spelt it wrong. Cirrhosis has that silent H in it, but it's not in the beginning. Like how you said it. CH, cirrhosis. It's cirrhosis. Cirrhosis. That's how you can remember it. Cirrhosis. Cirrhosis. Yes, Amy, you're correct. Alcohol abuse. A lot of the paracentesis exams that we do in ultrasound are due to liver cirrhosis. Plenty of them are due to liver cirrhosis. And I've talked to many of those patients. A lot of them drank like cans and cans of beer when they were young. It's like excessive alcohol abuse. And then it causes your liver to go bad. Cirrhosis. Cirrhosis. That's how you spell it. Cirrhosis. Yes, you're correct. That is correct. Cirrhosis. It leads to portal hypertension. Portal hypertension. High blood pressure. Becomes nodular. Nodular, so the liver is a little bit like roundy and has irregular borders. Your liver is supposed to be smooth. Your liver should be smooth, smooth-walled, smooth borders, not hetero, but homogeneous. Homogeneous. Schmood. Schmood like a schmoody. Like this one. Schmoody. Cirrhosis out here ruining. See, I can't even read. Ruining spelling careers. Seriously. That silent H. Jackie, you could even see that in peds. Yes, there's a lot of pediatric patients who actually have cirrhosis. Unfortunately. Born with it. And it says here, in children, usual form of cirrhosis are biliary and postnecrotic. So, yeah, the liver will be like kind of shrunken. The caudate lobe will be kind of enlarged. And sometimes these pediatric patients will, the ones that do end up living a longer life may have to obviously be on medication and whatnot, but they may have to do paracentesis procedures. We have some pediatric paracentesis patients, some even in babies who are ventilated. A lot of the times they're born with cardiac defects. So you guys that are going in echo, you're going to be doing fetal echo on these little babies with heart defects. A lot of them are congenital heart defects, and they will potentially have something going on with their kidneys or their liver, which causes ascites or fluid buildup in their abdomen, and then you'll have to do a paracentesis on them. So yeah, we have some peds patients that get paracentesis procedures once a week or once a month, and they just drain their bellies out because of the liver. Oh, hello, Emma. Drive home safely. We're just doing liver. Jackie, I learn congenital heart defects and think about them all the time. I know. Because I work in a pediatric hospital, we have the NICU and the PICU, and a lot of times, a majority of them all have congenital heart defects. And I don't know how the echo techs do it, but they scan I'm pretty sure they scan the peds' hearts with a doctor. I'm pretty sure. Don't quote me on that. But they'll order like renal ultrasounds, they'll order abdomen ultrasounds, right upper quadrant, but you might as well do a full abdomen because you want to see that spleen and the left kidney to see what it looks like, especially if they have hypertension already when they're born. Sometimes this is also caused by, you know, obviously the mother and whatnot. Like there are some patients where we've had their moms who drank alcohol, so alcohol induced from the mother, maternal, and then obviously it goes to the baby. Not good, not good. So look at this picture of the cirrhosis on here. Very hetero. And then the black here, you know, that's the ascites. And then look at these livers. Very hetero. Hetero liver. Hepatitis and fatty infiltration, which is usually echogenic liver. So, which you see a lot of echogenic livers. Emma, are you going until 9? No, I'm actually going until Chef Babe comes here and makes dinner. So I had just gotten off from work, and then me, Jackie, Veronica, and a couple of other people, I don't know who were in there, were watching Dr. Johnson, and we were watching his little live stream, and then I went from that to studying. And we're talking about the liver. It's much better when I talk about it out loud, don't you think? I think so. Yes, I was wondering where you were. Where were you? Where were you? So the caudate lobe has its own blood supply, so it's spared from the disease. Ooh, that's good to know. Caudate lobe has own blood supply, so spared from cirrhosis. Interesting. M. Yang studying. Lower extremity venous exam. What's up? You can do it. What are they testing you on your lower extremity venous? Are they testing you like you need to actually do the exam? Are you doing it on a classmate, or is it in your lab clinical session? Is it on the protocol? Is it on abnormalities? Emma, didn't have my phone on me. Oh, okay, enjoy your shower. Let's see, what does the book say? What does book say about cirrhosis? Oh, well, we're at fatty infiltration now in the book. Oh, here's cirrhosis. Book says Cirrhosis is a chronic disease process characterized by parenchymal destruction, scarring, nodular regeneration, and disorganization of the lobular and vascular architecture. So there could be micronodular, macronodular, and mixed. Does it say that in mine? Just very heterogeneous, nodular. I'm just going to say heteronodular shrunken. Babes is on his ways. Just a lecture, lower extremity venous exam. Getting tested on the lower extremity vein anatomy, DVT, and SVT. Ooh. Nice. Okay. Go ahead if you want. Type out the lower extremity vein anatomy. If you're going from the common femoral vein at the junction, are you saying you have to write down the anatomy from there going down all the way to the posterior tibial veins? DVT and SVT. Ooh. And are you scanning those in clinicals already too? Because you're doing your clinicals too, right? So, you got this. You know it. You know it. There you go. See, and I like that you're scanning too. For me, it was just like lab only. And then after lab for like those couple of months, then I went to clinical. And then it's just like, then you learn everything. For my program, at least. That's how it was. Hepatitis. Inflammation of the liver. Starry night appearance. It's acute. Causes in children. Biliary atresia. Biliary atresia. Toxin accumulation. Inherited metabolic diseases. Fatty infiltration, so echogenic livers. Steatosis, the accumulation of fat in the hepatocytes or the liver cells. Hyperechoic. Poor ultrasound penetration. So what does it say on here? It's on here somewhere. Here we are. Hepatic steatosis. Am I saying that right? Results from excessive intracellular deposition of triglycerides within hepatocytes. Two major types of steatosis based on the size of fat droplets within the hepatocytes. So I think I just need to know what it looks like. Look at this, liver. Very, very echogenic, coarse heterogeneous. Can you see that? Oof. See that? Very echogenic. Oh, I can push this, like, is this what I can push? It makes it bigger. Well, that's pretty cool. Oh, I can move it around. Look at that. Wow. And now how do I get out of there? So I think it's just going through the images. Ooh. Ooh, look at that. Very echogenic, heterogeneous, coarse. But how do I get back out of this photo? Technology. Technology. How do I go back? Oh, do I push this button? No, I don't. How do I go back? Here we go. Oh, let's go here. Okay, we're back. We're back to steatosis. Ooh, escape key. Maybe I should try that next time. Thank you, Jackie. So steatosis, eh? Okay. Yeah, I like that we have clinical 2 times a week. My first time in clinical last semester was so intimidating. We do a lot of DVT scans during clinical, and we didn't learn it until now. Ooh! Yeah. Yeah, especially when you first see it for the first time, and you're like, what am I doing? And sometimes the concept of following the vein all the way down is actually kind of hard. But then it gets easy the more you do. Oh, Babes is here. Okay, coming. Be right back. I hear him. Here he comes. I see you. Okay, be right back. Okay. So, what do you guys think? I need opinions. I need opinions. So when I do future study with me's, obviously there's going to be the ones where I record, it's silent, and it's me studying. Would you guys be interested in me talking about stuff? I know that I'm not a teacher, I'm not a doctor, but talking out loud and saying things out loud helps me personally remember things. Pyogenic pus, right? So what do you guys think? Do you guys think I should talk about stuff that I'm studying? I don't know. Emma, my earring for my piercing came. Ooh, I want to see. Send picture. I just got this like one here. I need to get a new one. Jackie, I like the talking. If it helps, why not? I do it, but to my cat. That's smart. I will do it. But if I do it and tell you guys, then you guys can learn something too. Right? 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 I will try to speak my thoughts. I do talk out loud a lot. No, I didn't change my net. It's still the same because I don't know if I can reconnect it. I should get a new one though. Miles Cooking Vlog. Hello, watching from Hong Kong. Oh, wow. Hi. Thanks for stopping by. Amy C. Only if it helps you. I'll just mute you when I'm studying. Then I'll be trying to listen and not study. There you go. Smart, right? So because like when I did the first 2 study with me sessions with you guys on the renals, it really did help me because I really did focus 25 minutes and 5 minutes off. I really, really did. I learned a lot about renal, and you know, I did these Davies Pediatric Sonography review questions, and after our 2 renal study sessions, I got most of the answers correct. So that means I studied pretty well with you guys on those study with me's, those 2 sessions. So I'm thinking about doing that, also doing the sessions where I talk to you guys about it. So maybe when like there's people on. Well, I go to the piercer. I don't trust myself. I'm scared of it falling into my ear. I know. I'm just so nervous that it's going to drop and fall and I don't know where it goes. I mean, it's nice to know what's on your mind because everyone studies differently and comprehends it differently, so your input would be nice. Plus, they say if you can explain it to someone, you really know your stuff. Yes, I definitely agree with that. M. Yang, you should in the Discord tell us the pathway of blood flow in the veins. Tell us what you know. So yeah, that's true. Okay. I'm just gonna do some videos, some live streams where it's like, okay, let's talk about the liver. And I know that my boyfriend like suggested doing some videos where it's like, you know, regular YouTube videos, but then me talking and explaining stuff so that people can like learn stuff through those videos. I don't know. Does that make sense? Silver Smith, hello, I'm joining in from Colombo, Sri Lanka. Wow, hello, welcome. I love YouTube. You get to meet so many people from all over. So yeah, those are some ideas. I'm gonna stop here then. I've been on this live for about an hour. I mean, not too bad. You guys learned some things. Cirrhosis, Echinococcosis. She said, Amy C. Off subject. I love the colors of the midliner pens you have. It's so many colors. I know. Look at all these colors. And then also look at these little pens in the middle. They're just these ones. And there's a highlighter color that matches it. Isn't that cool? And then on the opposite end, look. So you've got this part where it's like for like highlighting really nicely. And then you've got the other end. It's like more fine. Honestly, I pick whatever color I want. Everyone's different. I love all these colors. So I make sure when I'm doing notes that I use a different color for each thing. So like, look at this page. So it's like the hepatic cysts get the green, congenital, this one. So I'm talking about abscesses here. So the abscess, it just differentiates the different subjects. So these are the cysts, and then these are the abscesses. And then this is the Echinococcosis. I don't know, y'all. I can't speak English, let alone medical term English. And then schistosomiasis. So yeah, I just kind of like do that. I just love colors. Some people like the colors, so when they're like making diagrams, they can actually be like, okay, anything with the veins is blue and anything with the arteries is pink. If I had to make like a chart and stuff like that. But yeah, I'm not that organized with my notes as far as like organizing it with colors. I know a lot of people are, and I could do that, but for me that would take too much time, and it just makes, I just highlight what I think needs to be stood out and what I need to look back at and know for sure. Everything else is just for me to have like muscle memory, me writing and me thinking about it, reading it, writing it, highlighting it, and all that good stuff. But I love these pens and markers, yeah. Citlali Hernandez, hello. Oh, what? Food's ready, babe. Okay. Hey, quick question. I'm currently in my physics portion of my program, and I can take my SPI after. I know Edelman's is really recommended for studying. Do you think it's worth doing the whole seminar, or would I be fine just studying from the book? I'll be honest with you. Yes, Green Edelman's book is recommended for studying. And yes, that's all you really need for studying. Now, there's other supplemental things if you need more on top of that. If you can't read that whole entire book and comprehend it, and if somebody was to ask you a question about anything on any of those pages, if you cannot understand that on your own, doing the seminar will help you. The only reason why it will help you is because someone is explaining it to you. They'll say some things that, you know, obviously you reading the book won't get by yourself or on your own, but they just go through the book typically. And I know the seminars are online now, so they just kind of do PowerPoints, but whoever's teaching the seminar is just going to basically tell you, okay, pay attention to this, understand this. It's pretty much the whole entire book though. So I didn't go to this seminar for SPI. I just used the green book. There are lots of like questions and answers online that you can do. Also Davies, also URR, which is Ultrasound Registry Review. There's Edelman X-Zone. So there's a lot of supplemental things you can use on top of just the green Edelman book. But if you're somebody that likes to hear someone talking to you and teaching you this stuff, then it's just going to supplement you more. It's just some people don't want to spend the money on the seminar when you can just read the book and understand it that way, watch videos, watch YouTube videos, and whatnot. So it depends on the kind of study type person you are. M Yang, it would be cool to have small video study sessions with each other. Yes, it would. M Yang, maybe we should do that. We should do that. I could put that on the Discord. We'll do that. Okay, babe, I'm coming. 2 minutes to 60 minutes. Bro Ed, it was fun hanging out. We'll catch you on the next one. Thanks, Bro Ed, for coming. Oh, Brownie. He's so cute. Did you do your SPI test after your first year of sonography? So, in my next video that's coming out, M Yang, tomorrow at 6:30 p.m., I talk about my timeline, but pretty much I took my SPI test in April of 2017. And that was while I was in clinicals. So I took it before I graduated. I graduated in May 2017. So I took the SPI in April 2017. Yes. So that was many, many months into my clinicals, but before I graduated. So you can usually take your SPI test after you finish the ultrasound physics class at your school. Okay guys, thank you so much for coming. I hope you learned a little bit about liver. See you in the Discord. If you're not in the Discord, please comment below or DM me on Instagram at lolgiselle on Instagram. And then my email is lolgiselle@gmail.com if you don't have Instagram, because many of you guys on YouTube don't have Instagram. Stay tuned for my video tomorrow at 6:30 p.m. And then we'll see you in the Discord. Time to go eat. We'll study again another time. Bye, Crystal. See you later. Get these highlighters if you don't already have them. They're amazing. Good night, Amy. Good luck on your speech. Bye, Jackie and Thomas. Where's my música? Oh, okay. Let's turn this off. Let's close this. We'll see you in the next video. Don't forget to hit the like buttons and subscribe to the channel. Okay, bye. How do I do this? You guys. Okay, bye.